Welcome back, students. After discussing about the cardiac cycle, now in this video let's discuss about the integration of the cardiac cycle with the ECG. Okay. See, before explaining anything, try to answer this multiple choice question, which represents a ventricular systole. What do you think is the answer? Just look at the options. Starting from the P to end of the T, end of the P to end of the T wave, middle of the R to end of the T wave, starting of the Q to end of the S wave. What do you think is the answer? So, how to answer such questions? First, you need to understand the integration. Okay, you have to understand what is a ECG and what is a cardiac cycle, and you have to integrate them. Already I have explained you about the entire cardiac cycle, event by event, all the 8 subphases I have explained you. Now I am going to integrate the ECG with the cardiac cycle. Now, let's say here I am showing you the ECG. ECG is the graphical representation of electrical activity of the heart. Okay. So, here is a P wave, let's say QRS and T wave. Okay, PQRST. Again one more P wave. Let's say again one more P wave, QRS, something like that. Okay. Now, listen carefully, students. First of all, tell me what is this wave that I am highlighting? Yeah, P wave, you know it. P wave, Q, R, S and T waves, PQRST. ECG is the graphical representation of electrical activity of the heart. Okay. Now you tell me, P wave indicates what? P wave means what? P wave means atrial depolarization. So, this is the place where atria is going to depolarize. Atrial depolarization, this whole area is representing atria is getting electrically activated. Never ever say atria is contracting at the P wave. So, usually students will confuse and they will say P wave means atrial contraction, QRS means ventricular contraction, T wave means ventricular relaxation. This is what students say. No. First, you need to understand there is two different things. There are two different things. Electrical events are different and mechanical events are different. Both electrical and mechanical events are different. First, there will be an electrical event followed by mechanical event. Okay. So, first look at this. This is atrial depolarization. This is the place where atria starts to depolarize. Okay. So, once the atria starting to depolarize, later atria will contract. If you want to know exactly where atria is contracting, atrial contraction begins from the middle of the P wave. Okay. So, all this area, okay, all this area atria is contracting. Okay. Do you know all this area, here all this area atria is contracting. So, this area is the area where atrial contraction occurs. Okay. Let me write in a different color. So, atrial contraction, okay, happens after the middle of the P wave. From the middle of the P wave, this is the place where atria is contracting. Okay. Now, tell me students, what does QRS means? So, QRS means ventricular contraction? No, ventricular depolarization. It's the ventricular myocytes which are undergoing electrically positive. That is a ventricular depolarization. So, never ever say ventricular contraction begins at QRS. No, this is the place where ventricle begins to depolarize. But where exactly ventricle begins to contract? Okay, ventricular systole begins where? That is, you know, ventricular systole consists of isovolumetric contraction, rapid ejection phase, slow ejection phase. So, isovolumetric contraction begins where? So, isovolumetric contraction or the ventricular contraction begins from the middle of the R wave. Okay, from the middle of the R wave. So, from the middle of the R wave till to the end of the T wave. Okay. So, all this is the ventricular systole which consists of isovolumetric contraction first happens. So, this area, let's say this is the area where isovolumetric contraction is happening. There will be rapid ejection phase and slow ejection phase. So, till the time, till after T wave or at the end of the T wave, ventricular contraction is completing. So, all this area from today you have to say, whenever someone asks you, QRS means ventricular contraction? No, ventricular depolarization. So, from the middle of the R to end of the T, all this area ventricle is contracting. Okay, all this area ventricle is contracting. That is first isovolumetric contraction, rapid ejection phase and slow ejection phases. So, all this area is your systole. Okay, so most of the students, they lack basics. This is the exact thing which they don't know. They will always think that QRS means ventricular is contracting. So this is the place of the ECG where ventricle is contracting. No, all this area from here till here, all this area ventricle is contracting. Now tell me, after systole, who is going to begin? Diastole is going to begin. Okay, diastole. Tell me, in diastole, how many phases are there? There are 5 subphases. One is called as a protodiastole, which is a very small phase. Most of the books, they don't even mention. I have told you. So first phase is a protodiastole. Let's say this is the place where diastole is going to begin. Means at the end of the T wave, diastole is going to begin with a protodiastole. After protodiastole, there is isovolumetric relaxation. There is rapid ventricular filling. There is slow filling phase, also called as diastasis. Diastasis. After that, who is going to begin? Atrial contraction. Again, will begin from the middle of the P wave. So from the middle of the, from the end of the T to one more R, I should say middle of the R. So all this area is the diastole. Okay, ventricular diastole, which consists of 5 subphases. What are they? Protodiastole, isovolumetric relaxation, protodiastole, isovolumetric relaxation, rapid ventricular filling, diastasis, and atrial contraction. So these are the 8 subphases. Again, listen carefully, guys. I have told you in the previous videos, in the cardiac cycle, there are 8 subphases. See, 1, 2, 3, 4, 5, 6, 7, 8. Okay. So systole is from the middle of the R to end of the T, and diastole is from the end of the T to one more R. Now I am integrating. Now the same thing I am integrating with the heart sounds. Okay. So how to integrate? Listen carefully. Let's take a line here. Let's say here's a line. Now on this line I am representing the heart sounds. Let's say. Tell me, what is the heart sound that is going to be heard here? Okay, what is this heart sound? Which heart sound is heard in the middle of the R wave? Okay, in the peak of the R wave or the middle of the R wave. What is the heart sound that is heard at the end of the T wave? Because you know, at R wave, which heart sound is heard? At the end of the T wave, which heart sound is heard? During rapid ventricular filling, which heart sound is heard? Now you have to tell me which heart sound is heard. So tell me, what is this heart sound which I am highlighting right now? Sir, this is the heart sound which is happening during the phase of the atrial contraction. So what is this? This is S4 heart sound. S4 heart sound. I have taught you that during the isovolumetric contraction, okay, during the beginning of the isovolumetric contraction, which heart sound will be coming? Systole begins with. Systole begins with which heart sound? S1 heart sound. Okay. And diastole begins with which heart sound? See, this is the place where diastole is beginning. Okay. So diastole begins with S2 heart sound. Have I taught you? S2 heart sound is heard during protodiastole, due to the closure of aortic valve and pulmonic valve. And now you tell me, due to the rapid ventricular filling, due to the 70% filling of the ventricles, which heart sound can be heard? S3 heart sound. So here in this diagram, I am integrating 3 things. I am integrating the ECG with the cardiac cycle and heart sounds. If I am the examiner, do you know what is the question that I am going to ask? The question that I am going to ask is, after P wave, which heart sound is heard? Tell me. Sir, after P wave, it's a S4 heart sound that is heard. Okay. R wave, which heart sound is heard? R wave, S1 heart sound is heard. At the end of the T wave, S2 heart sound is heard. Before P wave, see, this is P wave. Before P wave, which heart sound is heard? S3 heart sound. Okay, this is how you may expect a question. So based on this, now answer this. Which represents ventricular systole? Who represents the ventricular systole? You know, ventricular systole, the systole is from the middle of the R to end of the T. Okay, so this is the answer. Here is the answer. Okay, and one more thing which I wanted to know regarding the cardiac cycle is, look at this. Look at here. One important law which I want to explain. Like this is a little miscellaneous topic, but important in point of cardiac cycle. That is, tell me, what is your end diastolic volume? End diastolic volume is 120 ml. You know how much you are going to fill the heart? 120 ml. That is also called as a preload. Okay. Then tell me, what is the stroke volume? Stroke volume will be, if you are filling 120 ml, out of 120 ml, how much is going to come out? 70 ml of the blood will be ejected. Okay, if the end diastolic volume is 120 ml, 70 ml will be ejected. Okay. Next, see, if I increase the end diastolic volume, if I increase the amount of blood in the ventricle, means instead of keeping 120 ml, now I am giving, let's say, 200 ml of blood. Now in the ventricle, I am filling more, 200 ml of blood I kept. Now what do you think, same 70 ml is going to come out? Do you think same 70 ml is going to come out into the aorta with the ventricular contraction? No. Now more is going to come out. Let's say now maybe 130 ml or 140 ml blood came. So what I am trying to say, whenever you increase, okay, here what I am trying to say, whenever you increase the preload, automatically stroke volume also increased. So yes, preload or end diastolic volume, it is directly proportional to stroke volume. Okay, directly proportional to stroke volume, which means if you increase the end diastolic volume, automatically stroke volume will also be more. The more you fill the heart, the more the blood you keep in the heart, the more will be ejected. Okay, you keep more blood into the heart is going to pump more blood. Okay, heart is just like a rubber band. The more you stretch it, the more powerfully it will contract. Okay, again repeat. Sir, the more the blood you are keeping, okay, the more the blood you are keeping, the heart will be stretched, so more powerfully it will contract. So this is called as Frank-Starling's law. Okay, Frank-Starling's law. Okay, so what is Frank-Starling law telling us? The Frank-Starling law tells us the more the end diastolic volume, the more the stroke volume will be. If you keep more blood in the heart, more stroke volume will be ejected. Okay, so the same thing can be discussed in a different way. The more the blood you keep, the more the stretch will be. Okay, when you increase the stretch in the cardiac muscles, when you increase the tension, okay, the more the blood you are keeping, the heart is like stretching, the left ventricle is stretching, the muscle is also stretching, which increases the tension in the muscles. The more the tension, the more powerfully it will contract. If you increase the tension means it's stretching, the muscle is stretching because of you are keeping more blood. The more it will stretch, the more powerfully it will recoil. Just like a rubber band, the more you stretch, more it will recoil. In the same way, the more you stretch the ventricular myocytes, the more tension is developed. With more tension, they will contract. This is called as Frank-Starling's law. With this, we have completed the integration of ECG, cardiac cycle, heart sounds. Hope the video is helpful. Thank you.